Welcome to Deborah Kobylt Live.
Thanks so much, Kurt. And everybody, thank you for joining us today for Deborah Kobylt Live. Joining me from New Jersey is my cousin, Sharon Parrillo. Thanks so much for being here, Sharon. Sharon is the Director of Infection Prevention at Robert Wood Johnson University Hospital, Somerset in Somerville, New Jersey. That's a mouthful, and it's an awful lot of work that you're doing there. I thank you for your service, really, Sharon. Talk to me a little bit about what's the mood, what's going on there in your hospital, and how are you all coping with this coronavirus pandemic that's affecting everybody?
So, the hospital has mobilized in such a powerful way. And I think what's nice about our hospital, particularly, that it's always been, a community type setting. It's always been like family here. And now more than ever, that really is helping us because we're able to really band together. Every single person in the building is doing everything they can to make sure that we all have what we need, that we're all supporting each other. So I think that's a benefit. I think some of the that are a challenge. We have our visitor restrictions, so there are no visitors allowed in the building. The mood is it's just so bizarre. You walk down an empty hallway where there's usually a lot of people, a lot of family in and out, and it's just empty hallways when you get to the care is being delivered. Some of the scenes are just kind of wild because so many innovative things have come to light, and our facilities team has done such great work in streamlining processes for our staff to minimize the interactions. So the physical layout of the hospital has changed. I think there's certainly the emotional toll on the staff, especially for our critical care team. They're doing such a great job making sure that everyone can FaceTime with their loved ones, because they aren't allowed to have visitors. So it's really challenging, I think, for them. So we're just here to make sure that everyone gets the support that they need, and we're all supporting each other. But certainly it's long hours. We appreciate so much everything the community has done for us. People have sent food and supplies, and it's just been very uplifting. So we feel the support, even though we're kind of isolated in the building.
Look, New York, New Jersey, Connecticut's the hotbed there of what's going on. What are you seeing in your hospital? I mean, is there an overflow where you are? Are you sending supplies out? Do you need supplies there? Why don't you, give us a visual picture?
So, what we're seeing is, I think what most hospitals are seeing in this area is certainly sick patients, right? And sick patients of all ages. I think that's one of the I think that's been misrepresented a little bit, and that only, elderly folks are having a hard time with this virus, and really everyone is at risk. So we're seeing patients of all ages. Luckily, most people are able to go home, and are doing very well. Some are critically ill, so there are challenges with that. But we have, just like all the other hospitals in our area, we've stopped elective surgery. So we have opened up every bed in the hospital to care for COVID patients or patients under investigation. That's what we call someone who's not identified as COVID yet. But we will use every bed in this hospital and every space in the hospital to provide care, just like every other hospital is trying to do as well.
Do you have the supplies you need, ventilators, masks? I mean, is there a shortage where they don't have enough masks, or extra ventilators are needed? Can you describe that for us?
We're very fortunate with our PPE, that personal protective equipment, all that stuff that you're describing, for our staff. We're very fortunate to have the supplies that we need. We implemented the CDC crisis alternate strategies very early on because we knew that this was going to be a marathon and not a sprint. So we've been very judicious with our PPE use to make sure that we can go the distance with this. And in doing that, we've been able to conserve our supply and have enough, to make sure that our staff is protected. But it's processes that we're not familiar with, right? It's processes that are uncomfortable for a lot of people. And that's what myself and my colleague, we're here 7 days a week, 15-hour days, to make sure that everyone has the support that they need as they navigate through these unfamiliar processes of the CDC strategy, protocols. So it's just a different way of doing things that they've not done before. So it becomes very stressful.
Director of Infection Prevention. What does that mean exactly?
Well, it's pretty much what the title says. We hope that we're preventing infection, right? We do our best to make sure that when someone comes into the hospital, that whatever bugs they come in with are the bugs that they leave with, and hopefully less bugs, right? But we certainly want to make sure that bugs don't transmit between patients and also between caregivers. So we want to protect our staff, we want to protect other patients, and we make sure that the staff have the tools that they need to do that. We make sure we provide the education so they understand how to do that effectively. But that's, I think, the majority of what we do. And certainly we do a lot of public reporting, state, federal reporting, to make sure that the government has their mechanism of tracking certain communicable diseases.
I know that you were featured in a local newspaper there, so congratulations for that. But you were talking about how sometimes nurses and staff will hold up a phone so that a loved one can speak to their loved one at home, right? A patient and talk to them. That's got to be a little heartbreaking, right?
It is heartbreaking. We're encouraging patients that have their phones with them that are able to do it on their own to FaceTime their loved ones. It's the best way to stay connected. I agree, with the last guest you had on, that seeing each other's face really has a huge impact, and not just hearing their voice. But for the patients in our critical care area that are on a ventilator, that are unable to move and pick up a phone, they can still hear and then sometimes see their loved ones. So it's really just the work that the nurses are doing. It's just heroic, and our respiratory therapists and really everyone has just come together in the best way to make this work. So, but it's very emotional for the team to do that. You're holding up a phone that, the loved ones on the other end, and I'm sure there's tears and there's sadness and there's so many emotions in that. And, as a staff member, you have to be just managing that and making sure you can facilitate that. So it's challenging.
How do you suit up when you go to work? And then how about when you come home? I mean, do you leave it there? Does it get washed there? I mean, what do you do to make sure you guys are safe?
Well, the CDC doesn't have any special laundering protocols for COVID.
Really? That's surprising to me.
There's really nothing special that we're doing. I don't have much direct patient interaction. My work is mainly in the hallways and outside the doors of the rooms. I just have very minimal patient interaction. But I think as a nurse, most nurses do this. I leave my shoes at the door. I've done that for the past 18 years since I became a nurse, so really no change there. Wash my hands as soon as I come home, take off my uniform, put on my jams, as my son would say, and usually wash my face, and I'm feeling pretty comfortable.
What do you need there? I know that you said that the community has really rallied with food and everything else. Tell me what you need. And also, I want to talk a little bit about blood as well.
Oh, yeah.
Blood. So tell me what you might need there.
I think that the biggest way that the community can have an impact here is to really follow the orders to stay home. People, even individuals who are asymptomatic, can transmit this disease, and certainly unknowingly and certainly not intentionally. But staying home will have the biggest impact. If you can work remotely, if you can do your food shopping online and pick it up, great. If you need to go to the store, fine. But then, practice that social distancing. It really is so important to make sure that we can flatten the curve. I know people have heard that term, but it's going to help us to be able to manage these patients over time, instead of seeing everybody all at once. Think about flu season, right? Flu season hits around October, November, and we have a peak in January, February, and it comes down around April, May. We stop seeing patients. But can you imagine if we saw every flu patient in 1 month? It would be totally unbearable. We wouldn't be able to do it. So that's what we're trying to do. We're trying to span this out over time, and that's the best thing that the community can do. I would say also, you talked about blood donation. There is some critical shortages in the blood supply because people are staying home. They're not doing their normal donations like they would. And call your local community hospital and make an appointment. I know here we're taking appointments for blood donations. We're doing some screening questions. We're doing temperature screening and things like that to make sure people are healthy. But if you're healthy and you want to donate blood, there may be some opportunities in your local hospital to do that. And lastly, people have been so generous. Call up your local hospital, see if they want some pizzas or some sub sandwiches, or we've had so many generous donations of food, and our food and nutrition director has done such a great job in spreading that throughout the hospital so that one unit isn't getting all the food and the other units aren't seeing it. So he's organizing that, and he's keeping a list of who got a food delivery, and they've got food deliveries going on all day long for breakfast, lunch, and dinner. It's just been we really are feeling that community support. So it's really just so nice.
What about homemade masks? Are they good? I mean, does that serve you or just folks at home? Because yesterday I think the CDC said, maybe it's a good idea if everyone starts to wear a mask, which by the way, I've been doing anyway since I heard about this. I wrap a scarf around my nose and mouth like 3 or 4 times before I can hardly breathe. But what about folks making their own masks?
So the mask situation is kind of unique. There's some benefit in wearing masks outside. I know the CDC had given that recommendation that for everyone to mask, they may be thinking about giving that recommendation, because it only works if everybody does it. If you're wearing a mask and I'm not wearing a mask, as I'm talking close to you, if I'm, if the virus is leaving my breath and it hits you in the eye, mask really is not going to help you. So it really is only effective if everybody does it. So the mask does provide some level of protection. The homemade masks are certainly an interesting thing, especially for us. We did recently put out a call to our community to start making some homemade masks for us. And those are going to be used as a last resort. So that's something that we just keep in our back pocket, because the CDC, as part of their crisis document, does say that if you have nothing left, if you've exhausted every supply, that you can use a bandana. So in my mind, a homemade mask that contours to the face is certainly better than a bandana that may slip, down while people are working and be flapping under their chin. So the homemade mask is certainly something that we will be considering as a last resort. We're not even nearly at that point yet, but having people make them and send them in was something that we really felt strongly about, so that we would have it, right? Because if at the time you need homemade masks, you can't just call, the local people in the community and say, all right, send me what you got. It takes time to make these things. They have to have some opportunity to do that. So we have been collecting them. We just started doing that this week. There are some studies about the effectiveness of the homemade mask. Certainly a tight woven material, a cotton, a poly blend is best. Linen and silk are the worst options. So there are some better materials that can be used. And certainly if you have 2 layers or even 3 layers is best. Some people are putting a flannel layer in between the inner and outer layer, which provides even a little bit more protection. But it is absolutely better than nothing. And it is something that we will consider if we need to go that route. But again, we're not even close to that point.
It's amazing to me how many people are not adhering to the guidelines and what is recommended. You may have seen the photos from out here in California over the weekend, people shoulder to shoulder at a local farmer's market. In New York City, as lovely as it was, but people just, holding on to the fence to see the ship that was coming in to the harbor. Of course, I thought to myself, really? And I actually know someone, my friend's husband, for example, right? He continues to work out with his buddies at the local park. And he comes home and she's like, why? You're going to put everybody at risk. But he's like, I'm fine. What do you say to those people who just don't quite take this seriously?
I say that I hope we have a bed for you. I hope that we have a bed for you, when you desperately need it, and it really is important to follow the direction and follow the guidance. And it's not that, this isn't Ebola, right? This is not like everybody's going to die and there's all this doom and gloom, but the volumes, the hospitals have to be able to manage the volumes. Right. We can help people and we can manage that, but it has got to be at a rate that is reasonable. We cannot see, 10,000 people in critical care in this state. We just don't have that many beds. So,
right. To your point, it's about the curve. Is it flattening the curve? Just keep it down and doing your part.
Slow it down. If we don't have the vents and we don't have the beds and we don't have the people to care for you, it's not going to end well. So I would say I hope that there's a space at your local hospital for you and for anyone that may be affected by what you're doing, but people feel well, right? So that's the dilemma, is that they say, well, I'm not sick, I feel great, but there is the possibility that people can spread it even before they become symptomatic. So just to be thinking about that also.
Are you starting to see in the tri-state area things slowing a bit? I know that's not necessarily your job to talk about that, but I am curious what you're seeing in your own hospital, for example, and nearby, just the directors that you speak with at hospitals locally.
Yeah, we are not, we've not peaked yet. We have not hit the top of We have not hit the top of that curve yet. So
Wow.
we're continuing to see patients come in and we're managing them. We've opened several units dedicated to COVID. Again, we've stopped elective surgery, so that has opened up a lot of beds. And certainly that's a smart thing to do. And we'll use every available space, but we've not hit the peak yet.
Wow, that's a little scary to hear. And they're saying what, toward the end of April? So that could be 3 weeks until we hit that peak, or mid-April, right? They're projecting.
It could be several weeks. It all depends on how people are. It all depends on what everyone's doing at home.
Right. So thank you so much, Sharon Parrillo, RN, Director Infection Prevention at Robert Wood Johnson University Hospital, Somerset in Somerville, New Jersey. I really appreciate you taking the time. Any parting words you'd like to say to me or my audience out there?
I just, I would say this is a great time to reflect, right? For those that are able to stay home, hug your babies tight, right? Tell your significant other that you love them and do something nice for each other. Try to make the best of it. I understand that being home is not easy. Homeschooling the kids is not easy, but we appreciate everyone's effort in this. We all would love to stay home. We'd love to be home, but we can't. So we're here working hard for you. And we hope that you try to slow down a bit, right? It's nice to be able to slow down, I think, and we don't get to do that very often. So it could be a nice time of reflection. Try to look at it as a positive instead of a negative.
And actually, you and I were talking on the phone yesterday, and I live out here in California and right near Hollywood, that you guys have become the superheroes, right? It's now the nurses, and doctors were always very highly regarded, but those of you on the front lines, I mean, honestly, risking your lives for us. I mean, for once now, you guys are the big superheroes. So
I think that has been so refreshing. You think about the celebrities and the sports, the organized sports, and the ball players, and all of that has just faded away, and they're not able to help people. They're not able to help in this, right? And nor should they. It's not their responsibility. But I think it really has shed a light on people that do such important work. I think about the people at the supermarkets. I think about the environmental service workers, facilities and maintenance and dietary, and everybody in this building that is so important. And it's all of us working together to make sure that we're able to provide this level of care. It doesn't just happen with one person or even one type of staff. It is everybody in this building making it work. And the same thing with the supermarkets and everywhere else that has been deemed essential. It's really shining a light on who we need to make this country work and to keep us safe. And the truck drivers delivering the supplies, and people that may not be normally very highly regarded, they are so important. And I'm just so happy to see that, to see that support and people in the community recognizing that. It's been really uplifting.
And let's hope that it stays that way, okay? Because bottom line, when there's a crisis, you guys are the ones that are on the front line. So thank you again, Sharon. And I appreciate it. And hello to your little son, Nolan, and the rest of the family out there in New Jersey. I miss everybody. So thank you for taking the time.
All right. Thanks. Have a great rest of the day.
Thanks, you too. And everybody, thank you for joining us today for Deborah Kobylt Live. And remember, you can see our show, which was just recorded live on Facebook. But after this, we'll be over on YouTube. And for those of you who listen to your podcasts, we're on iHeartRadio, we're on Apple Podcasts, Spotify, Spreaker, and just about any place else where you get your podcasts. I appreciate Sharon joining us today and all of you joining us on Deborah Kobylt Live. And we'll see you next time. Bye-bye.